Good morning. You are warmly welcome to our Visual Arts for Brain Health webinar. Delegates from all over the UK, from Australia, Canada, Indonesia, the Republic of Ireland, Romania, Singapore, Taiwan, hello Joy, and from North Carolina, Oklahoma, Oregon, Texas in the United States. Each year, there's some 10 million new cases of dementia, over 200,000 in the UK alone. As yet incurable, a terrifying prospect. A third more are undiagnosed. Their symptoms can be eased and confidence maintained if people are empowered to engage in weekly arts and well-being activity to preserve their brain health and resilience in the community. You will hear today how effectively and enjoyably the visual arts, the subject of our webinar, triggers people's imaginative and social skills. Exploring and discussing the amazing range of objects in a museum, or creating art in a studio or at home, and celebrating together at exhibition is a truly engaging way to relieve the loneliness, fear, and trauma people feel in the period leading to diagnosis of a potential dementia. So our aim being to enable support at this vulnerable stage, we do not debate post-diagnosis, for which the arts are well established. Rather, creative aging models and the social prescribing route from the surgery to museums and visual arts programs to preserve brain health. Our speakers today will present a variety of arts opportunities, though thanks to training in mild cognitive impairment and early stage dementia can be continued post-diagnosis, and how GPs, patients' first port of call, can now refer them earlier than ever before at the outset of symptoms through their social prescribing link workers to local arts opportunities to protect against cognitive decline, encourage ingenuity and self-expression, and bring a joyful sense of camaraderie and accomplishment. As founder of Arts for Dementia, arts post-diagnosis are vital too. Our speakers also run programs for dementia post-diagnosis, but during peri-diagnosis, when people fear the stigma of dementia, the use of more positive language stimulates incentive, the idea of taking action to preserve their own brain health. I should like to say how grateful we are to Professor Martin Orrill for chairing today's webinar, whose format is each speaker talks on their subject for 5 minutes, then a moment for the kettle, then on with the debate, chaired by Martin. It will be a great honour to hear from Professor Semyozeki, Professor of Neuroaesthetics at UCL, on how the brain responds to the pleasure of and beauty of the arts as a daily necessity. Helen Chatterjee, Professor of Biology at UCL, winner of the Health Humanities Medal for her research into how museums can be beneficial to health, speaks on creative health, connecting research, policy and practice, and the National Academy for Social Prescribing Academic Partners Collective. Sue Mackay, Director of the Thackeray Museum of Medicine, on how arts organisers can raise awareness of their programmes to preserve brain health through their regional Culture, Health and Wellbeing Alliance network. Sue will talk as a duo with Ruth Salthouse, Wellbeing Coordinator at Linking Leeds, because brilliantly, the Linking Leeds Social Prescribing Service operates from the Thackeray Museum. What a model. And we are especially pleased to have Ruth with us because Sarah, as our learning coordinator, has had to pull out with back troubles, but I'll tell you more about that in a minute. Pam Charles then explains how Leeds Black Elders naturally encourages people to continue enjoying their arts activities when cognitive challenges arise and long after. Down to London, but national. Kate Mason, Director of the Big Draw, which we know of as a national and international festival, will explain the range of resources available to arts organisers. Jessica Santa shares Art by Post, the terrific South Bank Centre initiative that enabled people to keep creating during lockdown and then to exhibit there. Prescribers reluctant to refer patients to short-term arts programmes will hear from Holly Power of plans for a wide-ranging, year-long programme at the Wallace Collection. On social prescribing itself, now Sarah Gorman, who isn't here, she's CEO of Edwards House at Gateshead and is the social prescribing Network Regional Learning Coordinator for the Northeast. Nigel, until recently CEO of A.R.T.S for Dementia, is going to read the excellent talk that Sean Brand gave as learning coordinator at our music webinar. And so you will learn from her this absolutely key role that the social prescribers play in a person reaching a music program via also the Culture Health Wellbeing Alliance network. And then we have Hamad Khan, who is now a postgraduate working part-time in development support for the Global Social Prescribing Alliance, and he will explain the bidirectional benefit of volunteering as a neuroscience student through the NHS Social Prescribing Student Championship Scheme to support people at arts programs to preserve brain health. So the webinar is being recorded, so as we said, if you can kindly keep mute and your images off. A typescript with links will be available online. And we're longing to hear you all, and it gives me great pleasure to hand over to our chair, Professor Martin Orrill, Director of the Institute of Mental Health at the University of Nottingham. Martin.
I'm delighted to be here, and thank you, Veronica, for organising a fantastic meeting, and thank you to all the participants from all around the world, which is really exciting. And I just thought I'd start by saying that I've just had the privilege to be involved with the opera by Justin Schneider called Take Care, which is an opera based on her own research on home carers working with people with dementia and their families. And it was recently put on at Lakeside in Nottingham. And I think that's a great way of linking the arts with dementia and helping to really give people an insight into what it's like as a home care and what it's like for people's experiences in that realm, which I think has been very much undervalued and certainly understudied. So I'm aware we've got a really packed program today, as they say, and I'm very excited to introduce our first speaker, Professor Semir Zeki, who is Professor of Neuroaesthetics at University College London. Semir, would you like to go ahead? Thank you.
Thank you, Chairman. Thank you, Veronica, for inviting me to this talk. I shall try to be brief by addressing the question of the necessity for the experience of beauty, not a luxury. We often associate beauty with leisure and luxury and class and money, but in fact it's a necessity for it for everybody. And to explain that, I shall go to Sigmund Freud, who asked a simple question: what do people seek? And he answered it by saying they seek happiness. Now, how do they seek happiness? They seek it by satisfying what he calls the pleasure principle. Now, it's quite important to realize that the pleasure principle, as he pronounced it, he pronounced it in German. And in German, pleasure is Lust, which means both pleasure and desire. So it's Lustprinzip. So if I could have the first slide. So the experience of beauty from whatever source, whether it's musical or visual or mathematical beauty or beauty from sorrow or from joy, always results in activation in this part of the brain, which is called the medial orbital frontal cortex, shown here in yellow. And that part of the brain is actually also involved in, is also active when people experience reward and pleasure. So it puts people in a good state, healthy state, euphoric state, and it is a large part of the brain. And these parts of the brain, any part of the brain, is not there for decoration. It is there to be made use of. And one of the uses to which that part of the brain is put is, in fact, the experience of pleasure and the experience of reward. And one of the means by which you can experience pleasure and reward is through the experience of beauty. So there you have it in a way. You have got an area of the brain that is specialized for what you might call hedonic experiences, but it is not sitting there waiting to be activated whenever you feel like. It's just like the spleen or the liver, or these things are active all the time, and they've got to be kept active. And in a way, the reward and pleasure centers of the brain should be kept active, and they can be kept active, among other things, through the experience of beauty, regardless of the source from which it is derived. And so the pleasure principle of Sigmund Freud, people disagree about Sigmund Freud's theories, but the pursuit of pleasure as a means of gaining happiness, which he claimed in his Civilization and his Discontents, his book, is the main thing that people pursue. The pursuit of happiness is, in fact, fundamental to our well-being. And one of the ways of pursuing that is through beauty, whatever its source. Thank you very much.
So delighted to introduce Professor Helen Chatterjee, also of University College London, a Professor of Biology, Genetics, Evolution and Environment. So Helen, welcome here, welcome, and please go ahead.
Thank you, Martin. Lovely to be here, and hello everybody. Lovely to see some friends and colleagues here. Well, my research is focused on understanding the biopsychosocial impacts of engaging in arts, creativity and community-based activities, including nature-based activities. And what that means is understanding what happens across the whole body. We're really interested in the emotional effects, cognitive effects, physical and physiological effects, and also the social effects. And like many people on this call today, I've been involved at various levels of thinking about how we can better connect the research that we do in the universities here and across the world with what goes on the ground, on the practice that many of you are involved in delivering with all different types of participants. And to that end, I've been working with the All-Party Parliamentary Group for Arts, Health and Wellbeing, like many people, Veronica and many people on this call. And I think you'll all be familiar with this report, I hope, the Creative Health Report, which was a key product of that inquiry, that all-party parliamentary inquiry. It was published several years ago, and it's a great place to go and start understanding the diversity of that evidence base. So what we know about the evidence is there's a fantastic plethora of evidence showing the benefits of arts, creativity and community-based engagement. But we know that we have a big challenge about connecting up that evidence base with both practice and particularly thinking about how we work better in partnership with healthcare partners, thinking about referral practices, which Veronica mentioned. So two of the really big recommendations that came out of the Creative Health Report and the All-Party Parliamentary Group inquiry, the first one was to set up a national strategy centre around creative health, thinking about how we can better make links with the health sector. And we did that 2 years ago. So Lord Alan Howarth, who's the co-chair of the APPG for Arts and Health, and myself and Alex Coulter set up a new national strategy centre called the National Centre for Creative Health. And I'll put you some links in the chat in a second. And that's a great place to go to work in partnership with organisations like the Culture, Health and Wellbeing Alliance, who you'll be hearing from later. We work in partnership with the National Academy for Social Prescribing, NHS Personalised Care, and many other different organisations to help think more strategically at a national level about how we can better embed arts, creativity and community-based practices in health to deliver better public health for our populations. Another key outcome was really to think about how we can better educate our new professionals entering both the arts sector and the health sector. So to that end, we've created a completely new programme at UCL. It's a completely new qualification, a Master's in Arts and Sciences, recognising the really interdisciplinary nature of the work that we all do, and also embedding those principles of creative health or health creation, embedding arts, creativity, nature and community-based approaches in public health. I won't have time today to tell you much about the details of that programme. Several of the speakers that you're going to be hearing from today come from organisations that we work in close partnership with. Our students go off to visit wonderful collections like the Wallace collection. They go off to visit and have activities like green gym activities, understanding the benefits of nature-based engagement. And all of the students work in partnership with a research project with an organisation, some of whom are represented here today, like NASP or like individual arts and creativity organisations. So we couldn't really run our programme without those really important partnerships. And I guess that really sums up the sorts of work that we're interested in, which is about those links, as Veronica said, that we need to make better between research, policy and practice. So I do encourage you to chat and think about what those links could be, and think about how we can all work better in partnership together. I think there's some fantastic examples of that coming up. So I won't take up any more of your time, and I'll post some links in the chat and look forward to the discussion as we move through our webinar today. Thank you, Martin.
Thank you, Helen. That's excellent. And I think this working in partnership is key, because I'm sure that some of the benefits are also related to the working in partnership element that you have for the arts. So I'm now going to welcome Sue Mackay and also Ruth Salthouse, who are going to present one after the other, but on about a particular piece of work that they're doing around Leeds, and very much looking forward to the talk. Thank you, Sue.
Hi everyone, great to be here. Thank you, Martin. I'm Director of Collections and Programmes at Thackeray Museum of Medicine. Ruth, do you want to just introduce yourself?
Yeah, hi, I'm Ruth from Linking Leeds, and I delivered the Linking Leeds social prescribing service out of the Thackeray Medical Museum.
So as a medical museum, we have an imperative to develop programmes and partnerships which really help people to care for themselves and for others. That is our mission. So two of the most important connections within this stream of work are with social prescribing and with CHOA. So that's the Cultural Health and Wellbeing Alliance, a national organisation which I think many of you will have heard of. So Ruth and I wanted to expand briefly today on how those strands connect in the work that we're doing, from the macro to the micro, and that's how we'll just structure our little talk today. So Culture, Health and Wellbeing Alliance, as I say, a national organisation, Arts Council funded, free to join membership organisation. I've just put the vision up there. But Veronica wanted me to talk about what we're doing in Yorkshire and Humber, particularly. So I am the museum champion for culture, health and wellbeing in Yorkshire and Humber, and there is also another champion who's Deborah Munt, and she's the arts champion. So our role is to ensure that relevant organisations and individuals in our region are connected in their work. So that's the Living Experience Network, the Museum Development Organisations, Arts Council, and other organisations such as Leeds Arts Health and Wellbeing or Network, LAWN. So we're meeting at the moment to discuss setting up a steering group, because for Deborah and I, it's quite a load at the moment to be representing the whole region, as you can understand. We advocate for the work that CHOA and Culture and Health generally does, showcasing national and regional work in forums like this. And we help members to develop their practice. So we currently have a call out for organisations to host a Doing It For Ourselves Together programme, which will be hosted by regional members to explore themes which are relevant to them, either recently completed or projects or things that they're looking to develop and looking for help from other partners and members. So that's what we do nationally and regionally as the Culture, Health and Wellbeing Alliance, which, as Helen mentioned, came out of the Creative Health Report as well. Over to Ruth.
So giving some context on where Linking Leeds is coming from as a social prescribing service, nationally with NHS England, we have a new 5-year plan for personalised care, which is trying to move away from health being a deficit model, i.e. you're only healthy when you are free from disease, and looking at it that way, into a positive model, which is looking at well-being, looking at strengths in the individual. So really trying to empower people with their own healthcare, their own well-being, and looking at it from a positive point of view. Now, social prescribing is a massive strand in this and has been funded UK-wide. So it's predicted that every pound spent on social prescribing saves the NHS £27.50 in costs. And what we're doing with social prescribing is empowering individuals to connect with things in their community, whatever that might be, that that positively impacts their well-being. So as Veronica mentioned in the introduction, with brain health, engaging in local creative arts things, as we all know, can really, really strengthen that health for that person. If you want to move on to the next slide. So what that means for us as Linking Leeds, we are working with over 500 people every month in citywide, and we embed ourselves in our local communities as best we can. We work with GPs, we get self-referrals, we get referrals from other organisations as well, to then link people up with local groups, services and activities to benefit their health. So in order to, as you can imagine, we've got lots of things in Leeds that can help people, and a lot of it grassroots. So we use a database to find the right services for people that are sat in front of us. So we try and keep track of all the information of all the partnerships we have in Leeds to connect individuals up with, depending on their individual need. I'll let you take over, Sue.
Okay, so how does the work that Ruth and I play its part in social prescribing at a local level? So we were the first museum in the country, as far as we know, to host a social prescribing clinics, which is fantastic and very exciting for us. And we also work with Linking Leeds to host social prescriber training as well. So that has involved, you can see a picture there on the left of the art doctors who worked with the Thriving Communities project that we have in Leeds, with both Linking Leeds and ourselves and a number of other partners, to put together training materials that would help the link workers to really explore what creativity can bring to health. And as well as working directly with social prescribing, we also, as a museum, develop creative wellbeing programs with local partners. We've had a particular focus for some reason on textiles at the moment. You can see there community participants contributing to our periods exhibition. And on the right-hand side, we're not only about personal well-being, we're also economic and social well-being. So you can see a group of women on the right-hand slide there who are learning to use sewing machines, producing products for well-being, but also improving their economic and life chances. So we've worked with a number of partners and social prescribing directly to further the wellbeing work that we do. Bruce.
In terms of what our clinic at the Thackeray means for us, is that we have a weekly clinic based in the centre of the community which we operate. So as I described earlier, we work all across Leeds city region, but we work specifically in each of our communities. So myself, as a wellbeing coordinator, covers this patch here. And as you can see, the museum is right in the heart of it. So it provides a really, really accessible space for me to hold my appointments. And although there are a lot of GPs based in the area, a lot of these are small converted family homes, so often don't have the space for myself, but also have just not been safe for me to use for the last couple of years due to the pandemic. So having this space at the Thackeray means I have a safe space to operate out of, to do my face-to-face weekly appointments. I can have more relaxed and creative appointments, so I can use the museum space to walk people through. It's less clinical, and it can get people thinking a little more creatively, a little more relaxed into what health and well-being means for them. It's also provided a direct link into new social prescribing opportunities. So everything Sue mentioned there with the new activities that they're doing, those go straight onto our database that I can use to link people in directly with, but also their volunteering opportunities. I work with the volunteer manager at Thackeray Museum to provide that information for people straight away when they walk in the door, basically. So yeah, that's it from me as well.
Okay, I hope that's been beneficial and you've learned a lot. Certainly as a museum, we've really benefited from the partnership that we have made with social prescribing. It's really encouraged local people to come into the museum, which is a really key aim for us. And there are many barriers for some people to engaging in culture, and so all the programs that we can put together to help overcome those barriers are absolutely fantastic. We have been brought together through the Thriving Communities funding, and Thriving Communities has now come to an end as a project. But as strategic and delivery partners together in Leeds, we've pledged to continue the work together. And Ruth and I are putting together a further training session for social prescribers so that we don't lose that link and we continue to introduce new social prescribers to the power of creativity in health. Thank you.
Thank you very much. An excellent joint presentation there. I like the idea of being an art doctor. That sounds like a very appealing job for me. And I think the idea of also having a living museum, which is really connecting with the community, is wonderful. Social prescribing is something that's, I mean, it's the present, but it's also the future. So we're going to need to be more involved in this and learn more about it. And I'm now delighted to introduce Pam Charles from the Leeds Black Elders Association. So Pam, you happy to go ahead?
Martin, I'm very sorry. Literally the second Pam's colleague has written to say that she can't come. So may I just say that Leeds Black Elders is the most wonderful organisation. It's an association where members meet as weekly, I think, and have arts. And if signs of potential dementia were to creep in, they're still welcome to stay. And if they're diagnosed, they're welcome to stay. And I did very much want to have her talking, but as you know, and as I know, all your programs are anyway inclusive. This was just our effort to have a speaker on their behalf, but we know that all programs are inclusive, and I'm very sorry that Pam isn't here to talk herself.
I think it sounds like a fantastic organisation, and I think there's a great value in being able to integrate people who have dementia, people who don't. And one of the wonderful things about the arts is you can enjoy them in the moment. You know, it's not like something that you need to build up a huge memory store for, like to help understand, enjoy. You can enjoy arts as and when in the moment. So now, then we'll go on to Jessica Santa, who's going to talk about art by post, and Jessica's from the South Bank Centre. Jessica.
Hi there, good morning everybody.
Good morning, hello.
Art by Post is a project that South Bank Centre run we started it in the first lockdown. South Bank Centre already had an arts and wellbeing programme that really focused on social isolation and loneliness, because we knew that was a huge problem across the country. Some of you will know that some research came out in 2019 showing us that 9 million people in the UK feel lonely some or all of the time. And we know that it has huge impacts on our mental health, but also on our physical health as well. So it's something we were already really concerned about. And when the pandemic struck, we knew it was going to become a bigger problem for more people across the UK. So we felt that although our buildings shut and most of our programme closed and 85% of our staff, 85% of our staff were furloughed, we felt the arts and wellbeing programme was the one thing we needed to keep doing. We could also see that huge numbers of arts organisations were turning to digital and offering really exciting digital programmes, but we know lots of people don't have digital technology at home. So we wanted to offer something different. So we created Art by Post, which was a series of booklets sorry, being distracted by the note from Veronica. I'll come back to that, Veronica. I can't read and speak at the same time. But yeah, so we developed booklets that could be sent in the post to people every month that were free. And we commissioned a fantastic range of artists to create those booklets with us. And we're really keen to find ways to continue to employ artists through the pandemic. So that was really exciting. And we hoped that maybe 300 to 500 people would sign up for this this project, particularly people that were isolated with long-term health conditions and didn't have digital technology at home. And almost overnight, 1,000 people signed up to the programme, and that the number just kept on rising until we had 4,500 people receiving the booklets once a month. So we then created a network of national partners to support the project, to help with recruitment, but more importantly, to be able to provide local support to those people, to signpost them to local services. And once people could start to leave their homes and to do face-to-face activities, they'd be able to invite them to their activities much closer to home for some people than London. And we always had this hope that we'd be able to have an exhibition. So along with the booklet, participants received a free post envelope to send their artwork back to South Bank Centre. Actually came to my house because South Bank Centre was closed, so the free posts were directed to my house. And it was a bit like that bit in Harry Potter where all the post just keeps coming through the door. Hundreds and hundreds of artworks and poems and letters and drawings were sent to us. And in September 2021, we were able to have an exhibition for 2 weeks at South Bank Centre, which was called Art by Post of Home and Hope. And the exhibition then went on tour to 5 other venues in the country to share the artwork with a wider audience. So it's been a really wonderful project. A really great way to stay connected during the pandemic. People talked about really looking forward to the yellow envelope coming through the door. We created bright yellow envelopes so people could recognise it instantly. And there was real excitement about those envelopes arriving and the booklets and finding out about the artist that month. But also people reported that they really felt connected to the large Art by Post community, even though they weren't meeting people. So we're now at the stage of considering what we do next with Art by Post, how we continue to stay connected to these people around the country, but how we also return to in-person, face-to-face activity at South Bank Centre. I'm going to wrap up because I know we're really brief, but there's a lovely film, a really fantastic documentary about the project on our website. I'll put the link in the chat now, and also I know Veronica will include it in the notes. Thank you.
Okay. Thank you. That's excellent. It's amazing to think of how many people you're actually in contact with and how many people you connected with in the pandemic. I mean, it's really an example of fantastically being able to reach out to people. So for me to introduce Kate Mason next, who's director of the Big Draw. So if Kate, if you'd like to go, and then after that we'll have Holly Power. Is that all right? Thank you, Kate.
Okay, so first of all, thank you so much to Veronica for inviting me on behalf of the Big Draw to take part. I feel like I'm in very illustrious company with everyone here. So very kind thanks to Veronica. So I'm just going to sort of whiz through, and I do feel that I feel like I'm coming at it maybe from a slightly different angle, perhaps in the terminology that we use at the Big Draw. So it's really interesting to hear how everyone's framing it. But for people who don't know the Big Draw, we've been around for 22, 23 years. Very much based on a community participatory based model work, and it's really just grown and it's spread around the world. So yeah, I often go into schools or universities and we get this idea of seeing people to think about drawing and visual thinking. So just so that everyone knows that the Big Draw isn't just about pretty pictures and drawing with pencils and paper. It's about making marks with meaning, and it's looking at how you might make marks with meaning across a whole range of different disciplines and sectors and different materials. So we work cross-sector, it's polymathic, it's interdisciplinary. So some of the things that on the slide at the moment that we talk about, which I think probably will resonate with some of the things that you will be talking about. So we use drawing, that's our tool, or mark making, a huge democratizing tool. It's non-verbal language, it cuts across barriers. We see a lot of event organisers and partners using drawing, mark making as it plays a key role in recovery from illness. And obviously people have been talking about isolation and loneliness, and we see that drawing and mark making being used a lot. And we have literally hundreds of case studies amassed from over 23 years. That's the challenge for us. We've been doing this for a long time. So it was lovely to see, if you see at the top, the Big Draw warmly welcomed that quote. That's actually from a recent Arts Council application. Like many charities, we found it very difficult in 2020, and we're delighted to get some of the recovery money. But it was quite funny reading the new focus for the Arts Council, because they are now, many organisations are talking in the language that we've been doing for the last 23 years. So it's interesting to see how things are shifting. very briefly, a little bit about our reach. As I say, we have a global reach. We have lots of participants, been around for a while. This is our global theme for this year. It's very much a vitality, celebration of joy theme. But just to get down to some, it's very hard for me to just hone in on a few examples because we have thousands of event organisers around the world. So I've tried to just pick a few that I thought might resonate. We have had and hopefully ongoing 3-year partnership with Care UK, which have 120 care homes around the UK. And we were thinking on lockdown what we might do together to make it work. Many of the care homes have these big, like massive screens in their rooms. So obviously they were able to isolate, and we were able to stream directly into those care homes. Very many of the care homes, most of them took part over the last few years actually, and we brought in some of our associated artists and advocates, people like Liz Atkin, people like Gary Andrews, to lead those sessions, people with lived experience. I think that's a very important thing, the lived experience. So Liz has compulsive skin picking, and she was able to talk about the using charcoal, and it's the haptic, it's using your hands, it's the hand-to-eye coordination, it's getting into the zone, it's that whole therapeutic effect of doing something that you enjoy. Really interesting to hear Samir's presentation earlier, fascinating. So getting into the flow and you forget where you are and what you're doing and the impact that has on your brain and your breathing and your body. So what we like to do really is we showcase, we champion lots of organisations that are doing this type of work. So that, it's just very difficult to show because there's so many organisers. The picture on the right on the screen at the moment, that was a very successful. So live drawing went into a number of the care homes, and the residents did absolutely really love it. They really responded. We had the feedback from their care homes that quite a few of their residents are obviously non-verbal, hadn't taken part in activities in their enrichment programme, but they did take part in these activities. That was lovely to hear. Gary is one of our ambassadors as well. He is quite well known on social media. He lost his wife to sepsis and started drawing as part of his therapy. The reason I've put him in as well is we do quite a bit with him, but it's this idea of starting a visual diary and a creative everyday habit, if you like, for want of a better word, something that we talk about quite a lot at the Big Draw, encouraging people to just draw daily. And not drawing necessarily pretty pictures, but to making marks, or whether you want to do it on the iPad or visual on pencil and paper, it doesn't matter. But just to get your brain working, just to get into the flow, it helps regulate your breathing, it helps you relax. Some examples of individual artists who did daily drawing challenges on lockdown for people online to take part in. So, obviously this isn't dementia specific, this is just for anybody who has been struggling with isolation. But very popular, so just a few examples there. Another one in Marigold the Maker. As I say, it's hard to pull out from so many thousands of events. Another one that we do in terms of a regular thing we do is we run sketch crawls. I think that brings together the haptic, the hand to eye, it brings the social context, people coming together. It's the outdoors, it's the nature, it's the slowing down, it's the looking at things, the fragility of nature around us, all of these things playing into feeling better. Where am I? So I just mentioned a little bit earlier about the people that we choose to partner and work with. We will always go for people with lived experience. And one of the things I did want to talk about very briefly about myself. I also have lived experience as the director of the Big Draw, and I use drawing and knitting actually and sewing to help me feel better. I've written about this. I have severe OCD if untreated. And I use my own social prescribing in my everyday life to do what I need to do. So this is coming from a very personal perspective as well, which I think feeds into our work. We have lots of resources. We have loads of videos online. We have loads of blogs. We have lots of we have a mini mag with resources. There's case studies online, all sorts of things that people can download. If people want to find out more and get in touch with us, they can just email us, and I'll put some things in the link later. So a lot to get through. Hopefully that helps. Thank you very much, and thank you to Veronica for having me.
Thank you, Kate. That's really wonderful. I love all the visuals. They're amazing.
Very visual, always very visual.
Yeah, but it's brilliant. I wish, the ideas and how it all comes across. And 7 million people is truly staggering, really, to think of 7 million being linked up with a big draw.
Well, that's direct participants over the 23 years. Yeah?
Yeah,
that doesn't include any of our digital audiences, which are enormous on top. But I would say to all of the amazing people on this screen that we want to share and champion what all of these organisations are doing. So if people do have stuff, we would love to be able to help share and promote them.
Excellent, thank you very much. So now we move to Holly Power, who's the community learning producer for the Wallace collection. Holly.
Yes,
welcome.
Good morning. Yes, hello everyone. And yes, thank you so much to Veronica for inviting me to speak today amongst a very esteemed group of speakers. So I'm very honoured. So thank you very much for including me. And I manage the community engagement programme at the Wallace collection. For those of you who don't know us or haven't heard of us, we are a historic townhouse located just behind Oxford Street in central London. We're a national museum and we have a very large collection. Our collection ranges from old master paintings, French porcelain, furniture, wax miniatures, and arms and armour, and all of which we use as a basis for a range of programmes that we offer. And I've just included some kind of images on your screen so you can get a sense of what we're like. And as Veronica mentioned at the beginning, we have a very kind of well-established programme for adults with a diagnosis of dementia. So from early onset dementia to late stages, we kind of visit a range of settings. We have a very well-established programme called Out of the Frame, where we go into care homes or we invite people into the museum, and we kind of have lively conversational sessions around the collection. But today I'm going to kind of present something slightly different to you today. It's a project that we haven't yet done. It's a project that we'd like to do. So we're just presenting some of those ideas to you today. And here are just my contact details as well if you would ever like to get in touch. So at the Wallace collection, we're particularly interested in how participation in arts and culture can influence feelings of well-being and social connection, and how they can support people to lead fulfilling lives as they age even. Through delivering regular sessions, what we've seen is that people keep asking us kind of, when you're coming back, when can we see you again? And it's that kind of regular engagement in arts activities that we feel people are really sort of lacking or kind of would like to be sort of regularly engaged. And it's interesting, Kate, what you were saying about kind of drawing and it being a kind of very kind of democratic thing. I think sometimes we find people are quite kind of nervous around drawing. The amount of times people tell us that, oh, I can't draw, but it's, we're very much equally, it's not about that, it's about trying things, it's about process, it's about just developing a creative response. So that's kind of what we're kind of about as much as anything. So today I'd like to share some aspirations with you for a year-long programme that we'd like to run for older adults pre-diagnosis. So for those kind of experience maybe mild memory difficulties or some kind of cognitive impairment, but not quite diagnosed, and they're going to their GP and they're starting that process kind of pre-diagnosis, and it can be a kind of long and quite alienating process. And we'd like to we'd like for them to be signposted to our programme. It would be a year-long programme, so that's kind of quite a long program, but it would be 3 8-week terms, so it would be broken up over the course of the year. I think working in partnership with organisations would be kind of essential to delivering this program, so particularly link workers and local social prescribing networks in and around the London area. Again, that's something that we haven't kind of developed as fully as we would like at the moment, so I'm very open to kind of hearing from you all about your advice and about kind of working with link workers and social prescribing. We kind of feel that our overall aims of the programme would be that if people engage in weekly arts activities in the months leading up to memory assessment and diagnosis, they'll be able to maintain a sense of identity, fulfilment and belonging in the community, and social connection would be crucial too. I know tackling loneliness is something that has been identified as part of the kind of GLA's long-term plan, and loneliness is a key issue in London, I've been told, so that it would be as much about kind of social connection as anything. And I've just kind of posted a quote on this slide here. I came across this report last week, and it felt very kind of fitting for the seminar today, and also kind of what we would hope to achieve. So it talks a lot about cultural participation, affording older people a range of positive emotional experiences, making them feel happier, and how it talks about how engaging with culture also led older people to feeling a sense of achievement through opportunities to experience challenge and learn new skills, and about personal identity and building collective identity, which in turn led to increased confidence and self-esteem. So that's all something that we would kind of draw on and hope to kind of achieve with a kind of year-long programme such as this. So thank you very much, everyone, for having me today, and I look forward to talking with you all later.
Holly, thanks very much. That's really exciting what you're doing. And I think we're going to be thinking later on about what the arts do, you know, how do the arts work, if you like, which is an important question. So I'd just like to thank also Veronica for organising this wonderful event.
As I mentioned, Sarah can't be here, but Nigel is going to read a really, really brilliant talk that Sean Brand, another learning coordinator, gave about a music programme. And so here is Nigel.
Okay. Yes, as Veronica mentioned, our invited learning coordinator had to pull out at short notice, so I'm reading this excellent talk given by Sean Brand to our music webinar to explain to you the role of the social prescribing learning coordinator. Sean is NHS England, East of England, social prescribing regional facilitator and learning coordinator. Thank you to all of our previous speakers. I've been in social prescribing for a number of years now, probably almost 7 years from when the network started, the national network, moving from a social movement of social prescribing to national policy in probably the quickest turnaround I've ever seen happening for the NHS in terms of commissioning something. So where does social prescribing sit? It came around formally within the NHS England long-term plan, which is now 3 years old. Funding for link workers has been in place now for 2.5 years. We're still relatively new in terms of national policy, but since that point, we've actually grown the workforce of social prescribing link workers to in excess of 1,500 across England. That doesn't include social prescriber link workers in the devolved nations or emerging across the world, as we know from Bogdan and the Global Alliance. NHS personal care, what matters to you rather than what's the matter with you. It's very much within NHS personalised care strategy. You may have heard the saying, it's about what matters to you rather than what's the matter with you. We're changing that conversation we have with people we're talking to in the NHS and really focusing on their strengths and their assets, their history, what makes them. Music is absolutely a key part of it. Surgery-based link workers. These link workers are generally based around GP practices. Many are hosted actually by voluntary sector organisations, but they serve a practice-based population. Anybody with a social need should be able to access a link worker at an appropriate point where they need it, and obviously never more so than during the pandemic. Have we seen the need for social prescribing link workers and that shift to supporting people in their social needs? And music, absolutely, as we've heard from the evidence, and it's wonderful to have that. Evidence plays a key role in health and well-being generally, so that the biopsychosocial model and the link workers play a key role in knowing what's in the community. That comes as a generic part of their role as link workers. But also the need has been mentioned by others, particularly around connecting and knowing what's happening in their communities. It will be different even across the county as to knowing what's available when, where, and to whom. I, in my roles as learning coordinator and regional facilitator, support the link workers directly, very practically around the learning and development. I'm opening their eyes, and I'll absolutely be sharing this webinar with all of my link workers in the East and the national team as well. Also, I support systems. We have emerging integrated care systems, and these will be the strategic leaders in regions that will be deciding how their money is spent. I will be placing in front of them things like this that say, look at the evidence. What are we doing? How are we spending our money? And we will work very closely with the National Academy of Social Prescribing, NASP, and the regional leads around thriving communities. What's really challenging for those link workers at the moment is working in a pandemic. They have very, very heavy caseloads. So if organizations or musicians suddenly pass their information to individual link workers, it's very difficult to get that grit around building relationships because they are so stretched. Even though the ambition of NHS England is to grow teams of link workers within the primary care networks and GP practices, we're not quite there yet. So raising awareness to link workers, the easiest way is probably to connect with your regional facilitator or learning coordinator and link with NAS Thriving Communities Lead for your region as well. That way we can build sort of mini distribution of knowing what's available for music in a set area and share that in a much more accessible way for the link workers to get hold of that information. We hold peer support sessions, and many of the areas actually like to have speakers come along and tell them what's going on. There are some really practical ways that we can help you. I hope you take that opportunity to link with those appropriate people. My job after today is to spread the message about this wonderful webinar and the Q&A that's just about to happen to the link workers in my region. I'll definitely do it with my other learning coordinators across the country. I will say it to the national team as well. Thank you.
Nigel, thank you very much. That's really, really great of you to step in and very helpful presentation. So I think finally for the presentations, we have Hamad Khan, who's the Development Officer for the Global Social Prescribing Allowance, and again has joined us to speak at quite short notice. So Hamad, we really appreciate you being here and very much look forward to your presentation. Thank you.
Thank you, Martin. I'll just go and talk about my section. My name is Hamad Khan. I'm a postgraduate student studying for my Masters in Global Health at UCL. I also work as a development support for the Global Social Prescribing Alliance, which is in partnership with NAS. But in my second year of my undergraduate studies, and I haven't been afforded the looks of my youth, but that was only 2 years ago, when I was studying neuroscience at King's College London, I had the absolute pleasure of being introduced to Veronica and the A.R.T.S for Dementia program. In my 3-month volunteering experience, I learned more about medicine, health and disease than what was offered in my university curriculum, even now. And I saw firsthand how dementia is more than just its physical symptoms and pathophysiology, that the personal burden of dementia can diffuse across relationships. But most importantly, I saw how patients were empowered by the arts in the very moment they were supposed to be disempowered and disaffected by their diagnosis. And dementia, along with many other diseases, is far too often defined by loss and deficit. Social prescribing, particularly with the A.R.T.S for Dementia program, allowed patients to find their health and well-being again. And this just won't be my personal experience now. The National Academy for Social Prescribing now funds the Social Prescribing Student Championship Scheme, allowing doctors of the future to learn, engage and promote social prescribing in their region, just like I did with my volunteering experience. And as a result, I'm proud to say we now have all medical schools in the UK teaching social prescribing in some form. And some places like Imperial College have now dedicated an entire module to social prescribing. And this year, as we welcome our new cohort of 22 studentship awardees, which I'm delighted to say also includes not just medical students, but allied healthcare students, we hope to further strengthen the truly medicinal practice of arts and health through social prescribing, where students can learn and experience the power of arts to our health and change the future clinical practice towards a more personalised, holistic biopsychosocial care model and recognise the power of creative arts to our patients.
Thank you, Hamad. That's really helpful, and it's great to hear about your experience. I see I'd like us to thank all of the terrific speakers for this morning. I'm going to send, you can do clapping, we can actually physically clap as well, but just thank all the terrific speakers, and if anybody else would like to, there we go, I see some more clapping coming up, but it's really been a wonderful set of presentations, lots to inspire us and lots of connections. And I think a lot of people, some of the speakers particularly, have joined this because they're great believers in arts for dementia, but also because it's a wonderful way of developing and maintaining connections. I'd like us to give something to have something to think about, maybe to have comments on it. At the beginning, we talked about the pleasure principle. And I'd like us to think about how the arts work, how the arts work on humans. And one of the things is that having an experience of the arts is not just in the moment. It is in the moment, but there's also looking forward to it, the anticipation. It's not just a snapshot experience. At the time, it's enjoyable, it's creative, stimulates reflection, but also afterwards, you can reflect and reminisce on it, but also it helps connect us in a relational way to other people and to the world, and helps with our identity and sense of dignity. So I think that sometimes people just think of the arts as in the moment, but actually there's the before, there's the during and the after. And I don't wonder if people would like to comment on that.
Yes, I'd like to comment on that. I think it's an extremely important point. I think what has come out this morning is the realization, implicitly, perhaps not explicitly, but the implicit realization that the arts and activity, artistic activity, involvement in the arts has an organic effect. I think people often believe that art is something spiritual and it's not something for the GP, for example, to prescribe, but it is. And if you want to reward the reward system, if you want to keep it active and going, you have to do that. I was extremely interested in what Kate had to say from the big draw, and it is, you see, why is it so effective? And the reason is that it actually excuse me, concentrates the brain in achieving a concept, the end result of which is the satisfaction of the pleasure principle. And I know that in Austria and Switzerland, it is used very, very regularly in hospitals, actual drawing classes in hospitals on a daily basis. It engages them completely until they get the satisfactory answer, which gives them the pleasure, which of course excites the pleasure principle. So I think as long as we as a society realize that this is not just something which is spiritual, but it is actually organic, I think we have, and I think it's implicit in all the talks this morning.
So Samir, can I ask you, do you think it's just a drive related to pleasure and desire, or do you think it's do you think there's other elements as well? Because that was how you, I guess, kicked off your talk in relation to the impact on the brain.
Well, this is a drive, really, but I mean, of course, Freud emphasized sex, but he actually did, as he would, but he also emphasized the arts. I mean, he did talk a great deal about the arts. I think it is a drive, but you see, why do you have that drive? It is like a hunger. See, it's got to be satiated. It's got to be you've got to eat, and in a way, you've got to also stimulate those centers of the brain. They cannot be left inactive. So I think it's a built-in drive. Yes.
Okay. So I'd like to move on to one of the questions in the chat from David Truswell, which is about how far people had success engaging with minority ethnic communities and including them in cultural activities in their work. Maybe people would like to, somebody would like to kick off with that. And then we'll, I can see there's a hand up as well. So any of the Kate?
I wanted to just sort of mention something that we tried. It was a new thing that we did, and we did it last year. Lose track of the years these times. Yeah, last year. And it was, we did a number of digital residencies for artists, but we spent quite a lot of time, of team time and outreach, trying to really work very hard on the language and the positioning and how it was promoted. And we did do it differently to how we'd done it before. We really did change the language and the approach with a view to limiting othering. I mean, like so many arts charities, and the arts and the Big Draw, I would say, is a fairly mainstream arts charity. To be honest, I don't think we are quite mainstream. I think they fall into that category quite easily. So we wanted to work. We had to work quite hard to do something different. But anyway, we did it. We did change it, and we had a totally different result, which was fantastic. And we had we were offering, I think it was nearly £2,000 for a pretty much free reign digital residence, whoever somebody, the artist or the collective wanted to do it, working with us with support from us and resources and mentoring and all the rest of it. And I'd never seen any of these submissions, these artists or these groups coming forward before. And the evaluation showed that the language made all the difference. They'd look at it, there's lots of arts opportunities out there, and they'd look at it and they go, actually, no, I will come back and apply for that, because that's for me. I can see that that is for me. And it was all down to the language, but also how we encouraged partners, community organisations to support us with the promotion, so at that grassroots level as well. But it was astonishing. I mean, I've been at the Big Draw for 9 years. I've worked in the arts cultural sector for 26 years, and I was a bit skeptical, actually. I thought, you know, it's not going to make much difference, but it really did make a total difference in who came through who, in terms of us being able to then shine a light on those underrepresented and overlooked voices, which is really what we wanted to do. I would say we had some pushback as well, which was quite interesting. Yeah, so we did have a few difficult phone calls. We had a few emails from people who were uncomfortable about the language, saying that it in some ways it excluded them. And they were mainly coming, I would say, from more of an older, white, more privileged demographic. But we did have that, which was interesting in itself. The residencies were hugely successful. Of course, they were bringing in their own networks. And yeah, it's something we would like to do more of again.
That's really excellent, Kate. Thank you. I know there's been some work on job adverts and job descriptions, and the language is crucial in terms of who applies and who's put off by it.
Yeah, I mean, I really was a bit like, really do it, because some of it it sounds awful. I'm a bit woolly-headed, so forgive me if I'm not being. When we were looking at the team, I thought, oh, that sounds a bit long-winded. Do you not think that's a bit long? And we were like, no, this is how we need to do it. This is what we need to do to reach the people that we want to reach.
There's something also, I think people use the term candidacy, where something's described in a way where you can kind of see yourself, oh, that's something for me. You know,
I think that was what we kept hearing. People were saying, we could see this was something for me. The people that we got a bit of the pushback on it. We made every effort within all the copy to say that this is open to everybody. So there was no, it wasn't like positive discrimination. It was open to all, but we were encouraging. So it was absolutely open to all. It was how the individuals were self-identifying. So actually, if those individuals that were a bit sniffy felt that they identified for whatever reason as being an underrepresented or an overlooked voice, fine, well, then they should have applied. But I think they probably actually
Thanks very much, Kate. And I think this is an important point about white privilege, because it's something we might not be aware of ourselves, but it is around. Helen had a hand up. I think it's down now, but Helen, do you want to come in?
I was just going to suggest that you bring Ruth in, because she might have some comments from her experience.
I saw Ruth's hand up as well, but I was a bit stuck as to which of you two.
Well, I was actually going to respond to yours and Samir's question, so maybe we can come back to that once we've addressed this.
Come back to Helen.
Thanks, Helen. Yeah, so as a citywide service, linking Leeds, we work with everyone. We've only got 2 referral criteria for our service, which is people are over 60 and registered with a GP. We also have access to translation, a translation service over the phone, which is on demand, which means I think it's around 30% of our clients are people of colour from different ethnic minorities, and so we see a lot of people, a really even cross-section of the population of Leeds, actually. And in terms of actually getting them into creative activities, groups, that sort of thing, what we find is successful is when, I think Kate mentioned a really good point about feeling like that space is for them. So in their local area, run by people who look like them or have similar experiences to them. And one of the activities at the Thackeray Museum, the textiles work, has been run by with a local organisation called Give a Gift, who are made up of Muslim women, and they're bringing in, you know, people who are of their community, you know, other Muslim women, to interact with the museum in that way. And that's where we find it really, really works. Having, you know, big institutions just put on activities on their website isn't enough. It's really letting those activities be run by the communities that they're there for.
I think that crucial connection and outreach, and actually having an understanding of what actually will work for them. Okay, Sue, do you want to come back in?
Yeah, I just wanted to build on what Ruth was saying there. We recently relaunched the museum with the aim of engaging with the local community. We're in Hare Hills, which is one of the most challenged wards in Leeds and in the country. It's an incredibly diverse and dynamic community. So we've thought long and hard about this, and you know, done various projects since we relaunched to engage the local community. And really what we found is that it's about putting yourself out there as a community asset and truly collaborating the programs that you put on. We have to acknowledge that there is a complete imbalance in the demographic of people engaged in the arts. We are mostly white, and at leadership level we're mostly, you know, middle-aged. So we need to acknowledge that. And we need to do a lot about our recruitment and importantly, as Kate was saying, about the artists and the other organisations that we collaborate with. So that's really, really important. But what we found works is to simply give space. We have the luxury of being funded by the Arts Council as a national portfolio organisation over a number of years. And that means that we do have the ability to give space to the community, literally allowing them to come in and use our space for meetings, which enables us to grow really exciting relationships and truly co-create programs. We find out what people are interested in, and then we're able to help them develop programs around it. So those are my kind of top tips, really: becoming a community asset, giving space, co-creating, and artist collaborations. Thanks.
Thank you very much, Sue. And I think actually space is a crucial thing, isn't it? Because a lot of organisations do want to have places to meet, and so if you can offer somewhere to meet, that automatically gives you a link and a kind of a way in, and showing that you have an understanding of some of their needs as well. Space of which is one of them. So just see if there's any more points on that, or we could go to. I know Helen was going to comment more on the thoughts on the how the arts work, if you like. Helen, should we bring you back in?
Yeah, I can do. It was just going back to that point, really. It's such an interesting discussion about what it is about arts. I would also include in that nature, and a lot of our speakers have talked about the importance of connecting with nature as part of arts and creativity. And Samir, you mentioned immersion, and I think it's also useful to think about that. The part of the benefits of these activities are that they are multisensory, and it's a whole body experience, even if that's just for some people simply using their upper body or thinking about things like hand-eye coordination. So you've got, as Samir says, that the sort of deep level cognitive processing, but there's also that emotional connection, and a lot of people have talked about psychosocial benefits. So I think it's really helpful to think about these benefits in the round of across the whole body, and that sort of embodied experience. There is a physical and a physiological component, and there is this deep level cognitive processing, and there is also those emotional and social connections. And for me, a lot of it is really about creativity is at the heart of all of that, and maybe that links into Samir's ideas about the pleasure principle and understanding the cognitive aspects of involved in creativity and being creative across the whole body. So I hope that's useful, but it really helps us when we think about articulating the benefits of these sorts of activities to think about the sort of multisensory aspects of it.
Yeah, if I may, I think Helen has raised a very, very important point, and I think creativity is one of the most important issues that we can address as a society, and it's one which is about which so little is known. I mean, why it gives so much satisfaction, why people you know, why it engages people so heavily that it satisfies them. I think it's one of the most wonderful subjects, but we've got very little in terms of grants awarded to studies of creativity, and very little is known about it. The only thing we do know about it is that it's extremely effective.
Yes, thank you.
Yeah.
I think it's interesting because I think also art has a role in making sense of the world for us. So that's not, I wouldn't say that's just something which is not just about pleasure, but it's actually about helping the kind of making sense of what's going on, sometimes making sense of trauma, making sense of what you want to be doing, where you want to be, and how you relate with other people. And we see this, have people, I guess people like watching dramas that they can relate to, you know, amongst other things.
Very important, yes.
So Veronica's mentioned the next webinar will be Nature and Heritage for Brain Health. And some of these things are actually about going back to nature, I see in the chat. And so I'm just look for any hands or any final points. We've got a few minutes left. It's been a very very rich and diverse seminar.
May I just say, so I think you just made an extremely important point, which we've just glossed over, about art has got a sort of giving you knowledge about the world. This is an extremely powerful point. I would just put it in a broader context. I would say that in a way it stabilizes our world for us. By giving you more knowledge about it, stabilizes, and there's great comfort in that. I think it's an extremely important point you made. Thank you very much for it.
Thank you. That's very kind of you. Thank you. Fine. I'm going to thank you very much all the speakers today, and also for the very interesting debate and the excellent points. I think the connections people have made in both in their talks and also in the chat are really very, very important. And then there's a paper in the chat about art, nature and mental health, which is in Perspectives in Public Health. So now I'm going to thank you all very much, and I'm going to hand over to Veronica for the closing remarks. Thank you all, and Veronica, thank you.
Thank you, Martin, for your excellent chairing. And it's been a real privilege. Martin is, I think, a psychiatrist, very involved with this field. And so it's been a privilege to have you chairing. So thank you so much. And to you all, to speakers, I just long for it to go on to hear more from all of you. Thank you very, very much. David Trustwell, who's here, who is the expert on dementia for ethnic minorities, asked a nice question, and I really do want to say that we do. I think it was great to hear from Kate how we adjust chat languages. I mean, I've been discovering at conferences recently how people are translating all their reports, their leaflets into innumerable languages to reach out to all ethnicities and people from all cultures and races and things. And I'd love to thank all of you for joining, and particularly the speakers for sharing. And thank you, Kate, despite COVID. I know how you feel because I still got the end of it. And it's fantastic. You've all shared so much, and we are so enormously grateful to you. Thank you very, very much.